guys. This is our group project on Ebola. My name's Jaden.
Hi, my name's Ariana.
And I am Rulin Gibson.
And we are presenting Ebola, and we are trying to understand an emerging threat. Some of the history of Ebola is it was discovered in 1976, actually during two different outbreaks that were happening at the same time in different areas. There is speculated to be one that is associated with Ebola in 1974, but there is no concrete evidence for that. Since 1976, there have been over 30 outbreaks of Ebola, even as current as 2026 today. And most of these outbreaks have occurred in areas of Central Africa. Most transmissions that are happening in other countries are happening because of travel, especially in modern day. More people are traveling, so things are getting spread further. Some things about Ebola, what it's about. There are various strains of Ebola. The particular one that causes EBV, I may slaughter this name, is ortho-Ebola-virus variant. It is one of the deadliest strains. There is a vaccine, but it is still highly deadly. If you do happen to get Ebola, the incubation period is 2 to 21 days. Symptoms get worse, obviously, like most diseases, as it goes along and becomes more contagious as well. It has a very wide range in fatality. There have been estimates from 25% to 90%, and that can depend on the strain as well. Because the symptoms can be so vague, it can be hard to diagnose. It can range from things like fevers and headaches to fatigue, very similar to like colds and flus, all the way to organ failures and external internal bleeding, which can lead to death. Like other viruses, or unlike other viruses, this is not spread through the air. It's not airborne. It is direct contact with infected blood, organs, or animals or different items that are contaminated, like needles or dirty clothing that have secretions from people who are infected. These are just a few infographics to kind of give you an idea and some more information on Ebola, some of the symptoms and how it's spread, and some of its sources. Ebola has an increase in dense populations. It usually starts in rural areas, and then those people travel, and that's where it can kind of increase and spill over into an outbreak. Usually it is people who are consuming bushmeat, which are like monkeys or other animals that are considered illegal to hunt in those areas. They are contracting it from that. It's often spread between healthcare workers or families taking care of other members who are infected, as well as people who are on missionaries or things like that. They may contract it and then travel back home or other places and spread it from there. Like I said, usually likely locations are going to be in the Central African areas. It was more contained in those areas, but as populations grow and places become more dense and again travel, it has started to spread. And a heavy factor for the occurrence of Ebola is seasonality. It has shown that it typically is more likely to spread from the seasons that are changing from wet to dry. The population density is much less of a factor than seasonality is for that. And these are just some of the kind of gives you an idea of the rates, like when it's a little less rainfall, not as wet, and things start to dry, there are more cases of Ebola coming out. Lots of groups, conservation groups, as well as wildlife efforts are trying to put bans and fines for hunting, illegal hunting of bushmeat to lower the consumption and the spread of EBD.
Perfect. So here are some of those factors and interactions that come with Ebola. You don't have to read everything, but the comic is kind of fun. So we'll give it just a second so you can read through that. Perfect. So there are 4 main causes of Ebola for the agents. Number 1 is like the Ebola virus that causes Ebola virus disease, but all 4 kind of contribute to what our understanding of what Ebola may be. So again, number 1 being that most common and deadly. I guess I'll just read them and make myself sound silly. Number 1 is orthoebolavirus xirense. Number 2 is orthoebolavirus sudanense. The third is orthoebolavirus bundubuguense. And that's the most deadly in terms of like fatality rate. And then the 4th is orthoebolavirus taiense, or the typhorus virus. So Ebola's environment, kind of where it thrives, is it thrives in situations with poor sanitation and like lower funded public health, where lower quality healthcare can often lead to untreated or unrecorded is kind of another big deal with Ebola. Again, high mobility and density, kind of like Ariana said, like obviously density deals with it, but more so the seasonality. But those regional borders and growing centers can lead to more situations for the virus to spread. And then traditional funerals are a really big deal. In Central Africa, with those traditional funerals, there's a lot of kissing of the corpse, kind of just trying to show how much they meant to you, but then that of course comes with contact with some of those secretions and with the body in general. Again, with the zoonotic portion, you should never go to a barbecue hosted by a fruit bat, or as Ariana said, never go to a barbecue of a fruit bat. So again, the African fruit bat is the most natural reservoir for Ebola, and then there are other hosts being primates, antelope, again, the bushmeat. Humans are more of that accidental dead-end host, so we don't really help the virus continue on, but we can contract it. Ebola vectors. So Ebola spreads, again, through that direct contact and bodily fluids with blood, sweat, vomit, saliva, kind of just any human secretion, but it's also been shown that secretions such as breast milk, or especially seminal secretions, are shown to be like places in the body where it can harbor the virus for quite a while. There was a study done that showed that a husband actually infected his spouse through sexual contact over 450 days after he himself had contracted the disease. So it can survive for a long time in those who do survive it. Ebola, you don't want to get... So now we find out kind of how this all affects us. So the initial risk is low. Again, it's really kind of contained to that Central Africa region. And it does have to come through that direct contact. It's not airborne, again, like was explained. And it's only contagious once symptoms start. So it's really easy to contain. It's not going to have the kind of the same thing that some of our other viruses have, like what we saw with COVID, where you can pass it on before symptoms. You have to be symptomatic in order to pass it on. And then again, the biggest risk is travel to those endemic areas of Africa, which are tightly controlled. So a strong healthcare system here, again, makes us much less of a risk for Ebola. Again, and then obviously we'll go over the what if. So again, an outbreak would most likely start from a traveler coming from Central Africa to the US. And again, we're going to talk about those early symptoms can mimic a lot of different diseases. They can get through probably a lot of airports looking like they have a common cold or flu or something. And then again, any secondary cases will come from contact with that patient who came by probably through the healthcare system as well. And then again, we have all of these checks in place where if we did start seeing symptoms and then a diagnosis of Ebola, we have the CDC and other agencies that would step in and start putting tracking and isolation to, again, control spread. This comes from the CDC themselves, kind of their explanation. It's overall a low risk because the likelihood is extremely low, but impact would again be high because we would be putting so many resources into not only treating but also containing. And so that's where we get a high impact, but with an extremely low likelihood. It's an overall low risk.
And so the medical treatment methods, are kind of grim because there is no known cure for Ebola virus disease or any of the Ebola viruses. But the primary treatment that you're going to see is just managing symptoms through supportive care. And then there's also monoclonal antibodies that we'll get into a little later. But that supportive care is really just managing the symptoms. So managing the dehydration through oral rehydration solutions. If your blood pressure drops from hemorrhaging, making sure that it's staying in a normal range, oxygen, pain control, keeping up with nutrition, all sorts of things. Another big thing is comorbidities. So if a patient presents with Ebola, but also malaria, a big thing you can do to help is cure or treat malaria first, or any other comorbidities. And there are monoclonal antibodies for Ebola, but they're only effective against the ortho-Ebola virusensis. There have been studies to show that some cocktails of monoclonal antibodies can be promising towards the other strains of the virus. But to this point, the CDC and the FDA have only approved their use against the one strain of Ebola. Imazeb is a combination of the 3 monoclonal antibodies, and Ebenga is a single monoclonal antibody, but they're doing the same thing. They're trying to bind to this glycoprotein to stop the virus from entering host cells. Both treatments have been shown to increase survival rates, 60 to 82% survival rates when compared to untreated individuals, which is significant. Significant factors that can increase overall survival rate or decrease depending on which side you go on are the time between first symptom and treatment. Like Ariana mentioned before, the viral load increases as time goes on. So unlike some other viruses which can be kind of stamped down by your immune system, usually with Ebola, the longer it goes, the worse it gets until you die. So treating early is the best course of action, right? And if you treat early, you will have low viral load. Age is also another big factor of it because most of the care is supporting symptoms. If your body can handle more dehydration than most, then you're more likely to survive. And then, of course, whatever pre-existing or acquired comorbidities that happen or don't happen while you are infected. Some preventative measures, obviously they include avoiding contact with bodily fluids. That's pretty much the main thing, a way that this virus spreads. And so avoiding those bodily fluids is of the utmost importance. This includes wearing proper PPE and avoiding anything that can even have come in contact with an infected patient, such as clothes or sheets or medical equipment. It's also important to never poke a dead bat or any other dead animals because you never know what they're carrying. There is a vaccine for Ebola virus, again, with the caveat that it is only effective against ortho Ebola virus syrense, which is that main one. But in clinical trials, it has shown to be anywhere from 84 to 100% effective at preventing infection with Ebola virus. Those who do contract Ebola virus disease are 1.7 times more likely to recover if they're vaccinated, which is also a pretty big number. And that concludes our presentation of Ebola virus.